Cognitive processing therapy, or CPT, is a 12-week course of treatment, with weekly sessions lasting 60-90 minutes. For example, maybe you've been blaming yourself for something. Your therapist will help you take into account all the things that were beyond your control, so you can move forward. Understanding and accepting that, deep down, it wasn't your fault, despite things you did or didn't do.
How about you?
Good, thank you. As we discussed during our last session, today we will focus on assessment and treatment planning. I'll have you complete 3 forms. The life event checklist, which asks whether you've been involved in a difficult or stressful event.
Early on in treatment, your therapist will teach you breathing techniques to ease your anxiety when you think about what happened. Later, you'll make a list of the things you've been avoiding and learn how to face them, one by one. In another session, you'll recount the traumatic experience to your therapist, then go home and listen to a recording of doing this as a homework over time may help ease your symptoms.
Now in PTSD, it works to help the patient gain control over the fear and pain that may be associated with their trauma. In some cases, flooding is the best option.
With EMDR, you might not have to tell your therapist about your experience. Instead, you concentrate on it while you watch or listen to something they're doing, maybe moving a hand, flashing a light, or making a sound. Stress inoculation training. SIT is a type of CBT. You can do it by yourself or in a group. You won't have to go into detail about what happened. The focus is more on changing how you deal with the stress from the event. You might learn massage and breathing techniques and other ways to stop negative thoughts by relaxing your mind and body. After about 3 months, you should have the skills to release the added stress from your life. Medications help you stop thinking about and reacting to what happened, including having nightmares and flashbacks. Several types of drugs affect the chemistry in your brain related to fear and anxiety. Doctors will usually start with medications that affect the neurotransmitters serotonin